Hello everyone. Welcome to NG's Corner for Nurses. Hope all of you are doing well. In previous video we discussed about the concepts and goal of emergency nursing and also the general principles of emergency care. In general principles there are 3 points: triage, primary survey and secondary survey. In last video, we already discussed about the primary survey and secondary survey. Today, we will discuss about triage. Let's start today's session. Today, we will discuss in this video the history of triage, concept, goals, purpose and principles of triage and also the benefits of triage system and triage team members. History of triage. The word triage itself has many roots. Initially, the word was used in 17th century Britain to describe the sorting of coffee beans. Then in French, they began to use the word triage to sort out or to thin down a group of objects. So, the word triage in both places is used as a meaning of categorization. Then in Napoleon's conquest, Napoleon invested this triage system in order to lessen the military loss and to strengthen the powers on the field. The aim is to quickly and methodically divide the injured into the groups based on their needs for medical assistance with the help of dedicated doctors. Let's come to the main topic, that is triage. The triage is the term derived from the French word trier, meaning to sort. Triage is the process of prioritizing patient treatment during mass casualty events. Patients are classified according to the type and urgency of their conditions to get the right patient to the right place at the right time with the right care provider. Next is the goals of triage. What are the goals? To identify the right patient who is in priority need, place him in a right place within a right time and under the right care provider. Next is the purposes of triage. First is to separate out the minor injuries to reduce burden on the management of critical cases. Here, by using triage, we are separating out who are with major injuries and who are with minor injuries. And like this way, we are treating the major injuries first. And this process is helping us to reduce the burden on the management of critical cases. Next is to provide the equitable and rational distribution of resources. By doing this sorting method, we are providing equitable and rational distribution of resources. That is, the critical cases needs more resources. So, by doing triage, we are identifying who is the critical one and who needs more resources. Next is to provide color code to establish the priority of access. Always color codes gives a clear visualization. So in the triage process, we also providing different color codes according to the seriousness of the patient, and it gives us a clear visualization to which patient need more attention, to whom we have to give care first. Next is to treat on the basis of the seriousness of the cases. We are doing this triage on the basis of seriousness of the cases. So, by using this triage, we will treat the most serious patient first, then the less serious patients. Next, we are coming to the principles of triage. This triage process should be simple, should be easy to perform, should provide for rapid and simple life-saving interventions, and should be easy to teach and learn. Next, let's see the benefits of the triage system or the advantages of triage system that we are using in our emergency departments. It identifies patients who requires rapid medical care to save life. It provides rational distribution of casualties. It helps us by separating out the minor injuries, reduced urgent burden on the medical team members. It ensures critically ill or injured receives priority attention. Establishes equity and anticipates resources needed. Predicts how long the patient can safely wait. Supports effective utilization of space and resources. Supports surveillance and improves communication and public relations. Next, coming to the triage team members. Not a single person can do this process. It is a teamwork, and this team includes emergency physician, consulting physician, triage nurse, emergency nurses, radiology technician, administrative assistant, pharmacist, housekeeping, and many more as per the need. Today is up to this. In next video, we will discuss about the types of triage and the different color codes. So next part will coming soon. If this video is useful for you, then it is requested to put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestion, you are most welcome to comment. Thank you for listening.